Hello everyone and welcome to today's live session. I'm Dr. Sudarshan and today I'm going to talk about a very important and very common topic, which is sciatica. A lot of people take this as a back pain, and that's their understanding about sciatica, which is simply having back pain or probably pain radiating down to the leg. So in the next 15 to 20 minutes I'm going to talk to you about sciatica, help you understand where and how, why does sciatica really happen, how can you get yourself treated for that, and what are probably some of the precautions you can use in order to ensure that you don't depend completely on sciatica for your life, or probably live with it. Okay, but before that, I would like to talk to you about our upcoming camps. This weekend I'm in Goa, and 30th Jan, 1st and 2nd Feb, we are in North and South Goa both, and tomorrow we are at our Thane clinic. So if you are looking for appointments, or if you're looking to consult me for your issues, whether it is sciatica or any other problem, you can connect me on this number. The number is 800-673-8000. So the number is 800-673-8000. I'm typing this number and I'll pin this comment so that it is easier for you to connect with me and take an appointment. So friends, let's talk about sciatica. I'm sure a lot of people have witnessed this kind of pain most of the time, and the patients that I see on a daily basis, they connect with me, and the issues that they have is more of the pain radiating down to the leg. Sometimes the pain is around the back area, which goes up to the leg. Sometimes it can go way down, way down. So let us understand what exactly is sciatica, what exactly happens here. Sciatica is actually not a condition it's in itself. It is actually a symptom which could be caused because of the compression of sciatic nerve. Sciatic nerve is one of the most thickest nerve in the body, which actually starts from your back and goes way down to your leg. Now, what is important here is that throughout this path, any area where it has a compression, which could be because of multiple issues, well, that will start giving you a pain down to the leg. Okay, so this is how you connect with sciatica, or understand why sciatica can happen to people. Because a lot of patients who come to me, they simply talk about the word sciatica, and this is what they understand, but this is actually what exactly happens. Now let us understand, why do you get sciatica, what is the reason, causes for sciatica. So one of the most important cause for sciatica is actually disc bulge. If you have a disc bulge, or if you have a herniated disc, there are high chances that because of this compression, it can start compressing on the sciatic nerve, which can actually lead to pain radiating down up to the leg. Now it could be a pain which is radiating right from the back up down to the leg. Okay, so disc protrusion, or herniated disc, is one of the most important cause of sciatica. Besides that, you will also see something called spinal stenosis. Spinal stenosis is something where you have a little bit of compression in your spinal canal. Now whenever you have a compression in your spinal canal, obviously that will again put pressure on your sciatic nerve, which can lead to compression of the sciatic nerve, causing or giving you that pain across the sciatic area. Dr. Saab Ortho, what is that request that you're giving me? Let me complete my topic here. Okay, you guys are requesting me to be on the video. Yes, we can do that, but maybe let us finish the topic first, and then we can be in the video. Thank you. So, like I said, what are the causes of sciatica? First is disc protrusion or herniated disc. Secondly, you have spinal stenosis. A lot of times you will actually feel that these mechanical factors are not the reason for sciatic nerve compression at all. Sometimes it is just a muscle. There is something called a piriformis muscle. If this muscle becomes tight, there are high chances that you can get this compression, or you can get a pain which is radiating down the leg. So we always target muscles like piriformis, which actually helps you to kind of decompress or stretch this muscle, which can allow you to decompress the nerve. So a lot of times, just focusing only on medicines or trying to just do some sort of therapy may not work. It is important that you also follow it up with the right kind of stretches and stretch your piriformis muscle, which can actually give you this kind of relief. Besides this, you will also see that can also lead to something called sciatica. So it's important that you have the right kind of posture, whether you're lying down, whether you're sitting. All of these things have to have the right sort of posture, because of which, if your back is supported well, if it is with the minimal amount of pressure, it will not, you will not have this kind of pain. But let's say you are doing it in the wrong way, then there is high chance that sciatica can happen. Now let us understand what are the treatment methods that you should go with sciatica. Most of my patients, they come to me after doing a lot of effort, after doing a lot of exercise, and one of the most important thing that they would do is just keep taking medicines. Now, like I told you, that most of the causes of sciatica are all biomechanical, or sometimes even with muscle tightness. So how will medicine help? Medicine will only help to reduce your pain. There is no other area where it will be basically painkiller, and that too for a very short span of time. So ideally, the role of physiotherapy happens when one of the important areas where sciatica can work is physiotherapy, where the role of physiotherapy would be stretching, doing the right kind of stretches for you, doing the right kind of core strengthening. I think having a strong core will definitely help you to keep your spine straight, and if your spine is good, if it is in the right position, if it is aligned well, there are high chances you will not have disc protrusions, you will not have spinal canal stenosis also. So having a strong core is one of the most important areas that a good physiotherapist will look at to target. Besides that, stretching on a consistent basis. A lot of times manual therapy also helps, because gradual mobilization of the back and trying to align the spine right, that can also definitely help while you're treating sciatica. And most importantly, which I always discuss with my patients, is posture education. Because if their posture is not right, and if you're not educating them about their posture, to keep the importance of keeping your back straight, the importance of keeping your neck straight, the importance of having your sitting right and avoiding too much of compression, all of these things are very important to prevent any kind of sciatic pain. Now let's talk about what is the role of chiropractic therapy when it comes to sciatica. Because let's say a patient who has a sciatic pain, he has seen an orthopedician, done some medications, and still there is no relief. He goes to a physiotherapist, he does all kind of activities, but still there is no relief. So what can a chiropractor do? How can a chiropractor help in order to reduce this sciatic pain? So one of the most important thing that the chiropractor will do is spinal adjustments. Okay, spinal adjustments is basically at any level, whether it is from L1, L2, L3, L4, L5, S1, all of these levels, depending upon the areas that are involved. Okay, spinal adjustments can be done, wherein we can help you to actually realign the spine a bit, try some decompression methods which can actually try and help you to decompress your sciatic nerve. So this is something which can help when it comes to chiropractic care. Besides that, a good amount of joint mobilization followed by the right kind of exercise and postural education is also important from a good chiropractic care. I strongly recommend all my patients that you should not completely depend on only movements or chiropractic care in terms of spinal adjustments. You should also go with exercises, you should also go with postural education, and understand the importance of these things. Because a lot of patients do come to me wherein they have done this kind of therapy and everything is fine. They see me again after 18 months, 24 months, where they have lost the exercise touch, they have not been exercising at all, and suddenly now the pain has again cropped up. So in this condition, it is important that exercises should be consistently followed. It should not be that you exercise for a week or 10 days till the pain is there and then just forget it. It doesn't work that way. Like you eat every day, you exercise, you need to exercise every day. You need to at least keep a good length of your muscles in order to ensure that there is no pain that is coming up on a consistent basis. Besides this, talking about a few more things that can help in case you have a sciatic pain, or if you know someone who has a sciatic pain. A lot of times heat therapy also works. So basically heat therapy will help you to kind of relax those muscles around the back area which will be in consistent spasm. So yes, heat therapy is one thing which can definitely help you. Besides that, the right ergonomics. Now when I talk about ergonomics, it is nothing but the kind of workstation that you have, like your table, your chair, how you sit. If your feet is touching onto the ground, what are the things that you are taking care of, how much are you bending when you're sitting. So all these things are very, very important, because you need to understand that your workstation is one of the most important places where you spend a lot of time. So if that is wrong, there are high chances that you will end up with a little bit of back pain. Again, with the workstation, it is also your sleeping position, so the bed. A lot of patients do have issues who are traveling. Most of my patients, when they are in a consistent travel mode and they don't have the right sort of bed wherever they are traveling, because probably they are hotels and all of these things, so they end up with a lot of back pain, because the wrong bed or the wrong kind of mattress can also trigger your back pain. So the right posture when you are sleeping, or even having the right kind of mattress, that's one of the most important thing. And yes, having a gradual amount of stretching is definitely something I strongly recommend to all my patients. So I think these are the things that you should take care when you have a sciatic pain. Don't just completely depend on certain things like your surgery. Let us say if you meet a doctor and he tells you that you just need to do a surgery and there is nothing else that can be done. Before doing your surgery, try everything under the roof that can actually help you to get your pain come down. And if you feel that your pain has come down drastically, there is actually no need for a surgery, because surgery for a sciatic pain will happen at a specific level. It could be L1 L2 level, it could be L5 S1 level. But imagine if that compression happens again, if it is repeated at another level, are you going to operate yourself again and again? That will not happen. Yes, if you have a severe mobility issue, if you find difficulty walking, if you have issues with bowel and bladder, then that is a condition where surgery is required. But normally 90% of the time patients don't go into those severe cases. You will have only 10% of people who will actually end up with these kind of issues. So that's where surgery would be recommended. And but then besides that, you need to try all kind of workouts, all kind of things that work. That includes physiotherapy, that includes chiropractic care, that includes everything that you can try and help reduce your symptoms. So I hope you have been able to understand about sciatica, and why does sciatica happen, what sort of therapy is required when you have a sciatic pain, and how you can get yourself treated. In case you are having this issue, or you know someone who's having this issue, you can definitely connect with us, and we can help you plan a treatment, and we can help you plan your therapy in such a way that you should be pain free. And trust me, it is not important that you need to live with your sciatic throughout your life. Definitely there is relief. There are solutions. I have seen more than 10,000 plus patients, and a lot of my patients, 90% of my patients, are definitely more than happy with spinal adjustments therapy. And if they can work out, I'm sure all of it can work out on all of you. um, Finally, I would like to thank you all for joining this live session. Shivjas, Kausar, Farooq, Singh Saab, Jamal, Sutpreet, Sumit Rane, Preeti Naidu, Shivani, Ashok, Tanya, Kameshwari, Amir, Hiren, Mayur Naik, Nitish Sharma, Kalpana, Riddhi. I think there are a lot of people, there are a lot of numbers here. Ganesh, Norman Shah, Delhi Wale Amir, Kunal, Preeti. You can put in your questions. If you have any questions, do put in your questions. I'll be more than happy to answer your questions, of course, because every patient has a different condition. And I'm sure if you can get to see me, and if we can try and solve your questions in a live session, I'll be more than happy to do that. So please put in your questions. You can type in your questions and I can answer your questions. Ramak Molan, thank you, Dr. Saab, Ortho, Power Yogesh, Faizan Abbas, Shehzad, Tejas Patak. I think there are many names, and I think I'm just consistently scrolling, so I don't think I'll be able to take up all the names. But thank you so much for joining, guys, and I hope you now have a better understanding of sciatica, and I hope you understand this problem more like a symptom than a disease, and not just label it, but understand that if you change your biomechanics, if you keep your posture right, if you try to stretch, things can get better, and your sciatica can definitely improve. So thank you so much for joining, and looking forward to see you in the next live session. You can also put in your topics, anything that you would want me to talk about. I'll be more than happy to discuss that. And yes, this is the number 8006738000 for appointments. In case you're looking for appointments with me, I'm based in Thane and Mumbai. We do camps in cities. This weekend I am in Goa, so we already have patients lined up for 4 days. And in case you want to see me in Goa, we can catch up there, and we can help you relieve your pain through spinal adjustments. So thank you so much. This is Dr. Sudarshan Singh, expert care for a pain-free life. Thank you.